How to monitor a negative pressure isolation room. A smoke or tissue test can be performed to test the pressure in an acute negative pressure chamber. A smoke capsule or tissue is placed at the base of the negative pressure room door to carry out these experiments. The room may be observed to be negatively pressured if the smoke or tissue is dragged under the door. What are negative pressure isolation rooms? Negative pressure rooms, also known as isolation rooms, are hospital rooms that keep infected patients or patients susceptible to infections from other patients, visitors, and health workers away. How to create negative pressure in an isolation room. Block any gaps to assist create a scale if the area has a door. Block the room with a heavy plastic drape if the area is open. Thirdly, put a portable unit in order to exhaust the contaminated air via negative pressure. The air is ideally vented outside of any location that people go through. What is a positive pressure room? The positive pressure should not contaminate the patient or the supplies in the airborne pathogens. For instance, the patient and the sterile medical and surgical supply may be subject to positive pressure in the operating room. What is differential pressure in clean rooms? The difference in air pressure from a site to another in a system is the differential pressure. Keeping the proper amount of difference, both positive and negative, is vital for avoiding contamination in clean rooms. How to calculate room differential pressure? A differential, DP, sensor or manometer is the most accurate means to measure the air pressure difference between the two rooms. A typical DP sensor device contains a single diaphragm with separated pressure connections on both sides. How to check a negative pressure room. Hold a little tissue about 1 inch above the ground outside the room in front of the door. When the room has a glass door, the glass doors are gently ruptured to be tested. 3. The tissue shall be pushed towards the room in the event of adequate negative air pressure. What is a negative pressure room used for in a hospital? A hospital that keeps patients with infectious disorders or those that are susceptible to other infections, apart from other patients, visitors, and healthcare workers, is termed an isolation room. How much negative pressure is there in an isolation room? You may feel the air being sucked into the room under a closed door or through a small opened window in a negative air pressure chamber. What is a negative pressure room in dentistry? Negative pressure rooms can help protect dentists against dangerous airborne and pathogenic particles. These are done by guaranteeing that any possibly contaminated particle is kept in the room prior to air extraction and cleaning. When to use a negative pressure room? Negative pressure rooms are to be used when the room is isolated and consists of infectious elements, objects, or even patients in the hospital. How does a negative pressure room work? The air pressure inside the room is basically lower than outside the room. When the pressure is maintained, the infectious air and contaminations from the isolated room don't flow outside to the non-contaminated areas and rooms. What are negative pressure room guidelines? Negative pressure isolation rooms shall require at least 12 exhalation changes in the air every hour, and a minimum of 1 inch WC must be maintained. The negative pressure difference of whether or not an anteroom is used in the neighboring corridor. A set point nearer to less than 0.03 inch WC is normally employed. What is a negative pressure room used for in a hospital? Negative airborne infections, for example tuberculosis or influenza, prohibit the isolation of pressure from fleeing and infecting others. The air is pulled into a room by a machine. Then the air is filtered and moved out. You can feel the air being sucked into the room under a closed door or through a slightly opened window in a negative air pressure room.